Well, thank you again for coming in today. I just grabbed our Oral-B Power Toothbrushes because I know you had some concerns about your new Oral-B brush, if it works as well as your manual brush does. So my instructor, again, offered that I should demonstrate to you. So we have two brushes here. One that I'm going to demonstrate on this Typodont, just to kind of show you some little tricks of the trade, so to speak, for using the power brushes. And then also we have what they call the Oral-B Test Drive, which is wrapped in a special sleeve that's only one-time use, as well as that disposable brush head. So that brush head will just be for that one use today. So we'll actually be able to use it in your mouth, which is kind of exciting.
Cool.
So we'll get to kind of get a feel for, because there's a certain kind of angle and a certain kind of technique to really remove all that plaque bacteria. And the research shows that a power brush is far superior at removing that plaque bacteria on the teeth than a manual brush, which is kind of nice. So I'm so glad that you purchased one. And yes, I know sometimes people get concerned when you buy a new device. You want to make sure that it's working for you. Because again, your oral health is excellent. So we want to try to maintain that for you, hopefully for a lifetime is the goal. All right. This is a Typodont. So our Oral-B, we recommend that you change the brush heads every 3 months. So you're going to start maybe today with a fresh brush head. So that way you're starting out anew. But with the power brushes, they're set with a timer, so you probably saw the timer. It gives you like a little pulsation after 30 seconds. The mouth is cut into 4 quadrants, and so it's 30 seconds per quadrant, or 2 minutes. Again, you don't have to be exacting, but it does help prompt people. So the Typodont here, one tooth at a time, and you want what they call a 45-degree angle, which is slightly angled, so that you're able to get up and around each tooth in all the nooks and crannies, going very slowly. So which is a little bit different than a manual brush in that you don't need to move it, and it's just one tooth at a time, and again, overlap is good. And you want to do the tongue side and the cheek side. So you're seeing my slow motion and slight to moderate pressure. You don't want to be too heavy because it'll stop the brush. And this brush here, this one, a red light goes on. Can you see that? So I'm not sure if you tried that on yours, which is kind of nice. It's a pressure sensor, which is built in. So do you think, what are your thoughts on that technique?
I think I could try it out.
So if you want to try, for me, or just to make sure that I showed you correctly, demonstrate for me how you would brush. This is your front teeth, and you can kind of see for a feel for the angle and how you're doing with that.
Okay.
Very nice. Good. So you can just kind of tilt your hand there a little. Very good. And again, that one tooth at a time. Excellent. So you can stop there.